That's actually a little better than last time, man.
Been stretching.
I have been stretching,
Yeah.
actually.
Alright, so we're going to work with Marco here. He has some issues with, it was the right hip,
Yeah.
correct? Yeah, so some difficulty with rotation in the right hip. So what we're going to do is, first we're just going to evaluate how the body kind of moves as a whole. So when I typically do that, I'm going to start at the feet and I'm going to look downward. So with him, he does have a little bit of a leg length issue where the right foot is a little bit dropped compared to the left. And when I bring this up, it switches on me. So what that means, it's originating up in the pelvis here. So we'll start with a couple adjustments to try to de-rotate the pelvis, and then we're going to get into the hip rotators and see if we can get those to open up a little better. All right, let's check into the mid back. So again, I'm checking where movement stops. This is a little bit lower. So I'm going to put him into a side posture here. I'm going to put you on your right side first. So we're going to aim our adjustment into the upper lumbar. That's kind of right in through here. So I'm going to lock that bottom leg to the top. Now for this, we're going to get into a little bit of extension. So my initial contact here, and it's already starting to move. Perfect. Let's go ahead and lay back down. Now I'm just going to work to de-rotate the pelvis a little bit. So he is rotated up towards this side, so I'm going to try to get the sacrum to lie flat down on the right here. So this drop table is a tool that we can use where the adjustments, most of the force is going to get transmitted into the table, so we can do a little bit more specific joint adjustments without it being super uncomfortable for the patient. Good, do one more. Yeah, so rechecking here, it's pretty much even. So we took out that rotation pretty well. All right, let's go ahead. We're going to put you on your left side. Now we're going to work that hip rotator. This is the fun part. So when we do deeper myofascial work, we're essentially removing adhesions between tissue layers. So you have like muscle, you have veins, arteries, nerves, skin, adipose tissue. All these tissues should be able to slide independently from one another. So whenever we get an adhesion or a stuck bonding between those layers, we end up restricting movement. And sometimes that can like grab onto a nerve. Patients can get sciatica if you have adhesions in this area. In his case, it's mostly just restricted movement, right? All right, so right about here. So this muscle attaches his sacrum onto his femur. So we're gonna use some movement to help open up those adhesions. So for this one, we're gonna bring the knee up a little bit, and then he's gonna straighten out through his leg and reach through his heel. Just like that, and he's gonna bring it back in. Whoo-wee, buddy. Again, these can be a little intense as we work through it because we're separating tissues. Reach through the heel, good, back in. Now as he goes through the repetitions, it does get a little bit easier.
Oh yeah.
Yeah. Usually if the first couple are the hardest ones to get through. Good. We're gonna do like 6 passes here.
My palms are sweating.
Yeah, so he's getting a little sympathetic nervous system response there. Fight or flight's kicking in. Good thing I'm not in front, so he's not going to kick me. That's why I stand back here. There we go. Good. Excellent. One more. Good. Now that we've released that, so we're basically releasing up the sciatic nerve from the piriformis muscle. Now you're going to lay on your back and we're going to do some PNF stretching for the external rotators. So we're going to bring this leg up and we're just going to start to rotate in. Now I'm going to use his body, his muscle contraction to help open this muscle up. So with this, I'm going to have you not let me rotate your leg this way. So try to prevent that rotation. Good. We're going to hold. 4, 3, 2, take a deep breath in, all the way out and just let it relax. Now as he relaxes after that contraction, I can get a little bit deeper into it. Yeah. Good. I'm going to come into a little bit more flexion on this one. Good, and let's do that again, so don't let me rotate you. Good, hold that. 5, 4, 3, 2, 1, and release. And drop. Good. Yeah, these hip rotators can be pretty tight in people. So normal positioning of this should be about right here with the lower leg, about 90 degrees. He's at about 45. Let's go ahead and push. 4, 3, 2, 1, and release. Nice and heavy. Good. Now from there I can get into some hip scouring. So I'm just basically gonna find the ball and socket joint and just work through the end ranges a little bit. Doing okay there?
Yeah.
Yeah. Good, one more. Perfect. I'm gonna cross this leg over. We're gonna do a little bit of a quick reflex stretch on this using the drop table. You're pinching your phone in there.
Yeah.
Alright. Alright, so for this I'm gonna apply a little bit of the stretch to that piriformis and just drop straight into it. So we're getting a quick stretch into the muscle, trying to reset the muscle tone. You okay there?
Yeah.
Okay. Let's check again. We're getting there. Let me check hamstring. Whoo-wee! So we'll do one on hamstring here. I'll be pushed down. Hold 5, 4, 3, 2. Deep breath in. All the way out. Let it drop. Good. We're gonna actually get in some external rotation here. Yeah, buddy. So some of this restriction may be included in one of its hamstring groups. So I want you to push down, but also resist my rotation. So this is kind of a different one. So press down. Now don't let me rotate. Hold 5, 4, 3, 2. Deep breath. All the way out. Good. And we use the breath because that helps us tap into that parasympathetic nervous system. Like you said, his palms started sweating. Typically that's a fight or flight type response, which is normal when we're dealing with pain patterns. So it's really important to incorporate breath into these. Let's do one more. Push down into me. Now don't let me rotate. 4, 3, 2. Deep breath in. All the way out. Just let it drop heavy. Ooh, yeah, buddy. It's getting there. Okay. We're gonna get Marco doing ballet in no time here. We got this. All right, let's go ahead and sit up nice and easy. So that's a pretty good example of how we would treat chronic rotation issues in the hip. We're not just addressing the hip itself, we're kind of following the chain up, looking into the lumbar spine, the thoracics. But yeah, just a little clue into how we work and how my brain is going when I'm working on people. Rock and roll.